Assalamu alaikum, the communication day. You have a scenario with Mr. George, 75 years old. He had ischemic stroke 3 weeks back, but wasn't admitted to the stroke unit as no bed was available in the stroke unit at that time. Was admitted to the general medical ward instead. He's now improving regarding his stroke. He has diabetes for the 5 years, which was controlled. Recently, he developed heel ulcers in his both legs while in the medical ward, despite the medical care. You are the medical senior house officer on duty. Please sit with his son, Mr. Jack, discuss the issue with him. Okay? Here you can start. Timer is ready.
Hello,
Yeah, hello?
my name is Dr. Sarah. I'm one of the doctor here in the ward. Am I talking to Jack, the next of kin of Mr. George, 57, 75 years old?
Yes, I am, doctor.
Yes, Mr. Jack, I'm here to discuss about your father's health condition. And I
Sure,
will,
doctor.
yes, we'll try to address all your concern. That at first, can you tell me how much do you know about your father's condition in order to be on the same page and address all your concern?
Yeah, doctor. I brought my father 3 weeks back. He had a sudden onset weakness, and when I brought him, initially they told me he should be admitted to the stroke unit. But I surprised when I found him in another unit.
So I can see,
Yeah,
yes, I can see how is your frustration. And I will try to address all of this. Yes, your father was admitted with a stroke because he was having weakness in his body. So at this time, and sadly, there was no bed available in the stroke unit, but he was admitted in the general medicine ward. But he was followed by the stroke unit and on daily basis. And the good things for your father that your father's condition start to improve with the treatment and also with the physiotherapist team. So I just want to update you that his condition is improving. So this is a good news and good response for your father.
so you mean, doctor, I can't take my father home?
This is a good question. Your father's condition is improving, but till now, the treating doctor, because he's still under the stroke unit, still didn't decide when he will be discharged. So I need to have a further discussion with the team, and I can liaise all the information for you.
Okay, doctor, thank you.
Yes. And do you have any other concern or any other question you want me to talk about?
Yeah, doctor. I noticed while he's in the bed
Hmm?
and I saw something strange, doctor, which he didn't develop at home.
Hmm.
When I brought him to the hospital, he was okay and his skin was okay, but I was shocked when I see the nurse doing dressing to his heels, and when I asked her, she said he had this soreness in his heels. Can you tell me what happened, doctor, exactly?
I'm really sorry about how you feel. So let me explain to you what exactly happened. As you know, as you might know, that when your father was has stroke, he wasn't able to be moved. So he was in his bed. He was bedbound. So what we are doing in such case, the nursing team usually they're trying to move his body from side to side and try to put some moisture on his skin in order to prevent such soreness in the skin. And let me explain for you the soreness of the skin, how it's happened. Okay, are you following me, Jack?
Yeah, doctor, but I feel upset because of this.
I'm really sorry about that, but you know this source will happen when the body compression between the body and the bone. Let me explain it for you. This is the body, and this is the bone, and this is the bed. So the body will be in between, compressed between the skin of the body will be compressed between the bone, which is hard something, and also the bed, which is also hard. That's why the skin might break and might cause this soreness. And are you following me?
Yeah, doctor, I am following. I'm trying to understand what's ongoing.
Yes, so this sores will happen like this when the skin will be pressurized between two hard things, which is the bed and the bone. And also when we are moving your father, the skin can be turned, the layer of the skin can be turned and can cause this soreness. So what we are doing here, we are trying to minimize this by moving your father from side to side. We have time to move him after some times of hours. The nurse have scheduled to move him to this side and then to the other side in order to prevent these sores. And on daily basis, they are trying to put a moisturize the skin to make the skin moist. But we are trying to decrease the risk of having this soreness. But sadly, the risk is never zero, and it might happen. I'm really sorry about that.
So, doctor, don't you think it's some negligence by your team since my father is supposed to be in the stroke unit and you put him in another ward? I
Yes,
guess something different, doctor. Can you explain for me? I think there is some mistakes, doctor, by your team.
yes, I can see how are you feeling now, and you have the right to feel this way. But let me explain for you. As you, when your father is admitted in any place, he received all the care from the stroke team and from us. And also he's improving. It means that he's receiving the care and his condition is improving. So I just want to reassure you that if your father even was admitted in stroke unit, he will have all the same care because we have this protocol and these guidelines in the hospital about the patient, caring of the patient and preventing such soreness. And I'm sorry that you feel that way. The issue is that the stroke unit they didn't have bed available yet, and when they have available bed, he will be transferred immediately. But I want to reassure you that he's receiving the same care as he's in stroke unit. Okay.
Okay, doctor. So what's you gonna do with him now?
Yes, what we'll do, I'm not, the nursing team is taking care of him. We'll try to manage the sores by doing daily dressing, and we will try as much as we can to prevent the other sores to happen. And I want to assure you that we will take care of your father and keep a close eye on his wound and his sore. Um, and we'll update you
Okay.
regarding him. Yes.
Still, doctor, I'm not convinced. I wanna complain about your team and your nurses.
I really appreciate that. And if you feel that you want to complain, it's your right to complain. The issues also we will try to discuss it with. I will try to discuss it also with the ward team and the nurse, the head of the nurse, to make sure and double check what why this source has happened, if there is any neglect that happened, and I might come back to you to explain for you what's happened. But as I told you, the risk is never zero. It might happen despite of the maximum care that we are giving to your father.
Okay, doctor, I appreciate really what you did with my father. I can see, yes, I can see him is improving. It's
Yes.
okay, doctor. I appreciate all what you offer to my father. Thank you.
Yes, and we also have involved the tissue viability team, which is our team responsible of the soreness. So they will see your father on daily basis and try to try to cure these sores and also prevent other sores from happening. But at the end, if you it's your I will try. I can have another talk with.
2 minutes left.
Yes, I can have another talk with you after discussing with the nursing team, and then I will update you about what's happening. Okay.
Okay, doc. Thank you.
Okay, just some question regarding your father. What do your father is in before admission? He was completely independent,
Yeah, doctor. He was fine. He can cope with his daily activity,
and
but
what?
I don't know
Yeah,
what will
okay.
happen now, doctor.
And he was and also he was working or what he was doing for
No,
living.
doctor. He was retired.
Okay, so I just so we have a discussion with you on the discharge. We might arrange a package of care for him, and we'll help you. And who is taking care of your father, or who will take care of your father on this?
Yeah, my mother sitting.
Okay, and so we can also provide you some package of care and some support at home. Okay.
Okay.
Okay, just some question regarding your father lifestyle. Does your father smoke?
No, he doesn't.
He doesn't. And what about alcohol?
He just occasionally drink it.
Okay. Okay, so at this time, as I told you, we will update you on daily basis regarding your father, and I want to assure you that he has a multiple specialized doctor, and the physiotherapist also are taking care of him, and will try to improve his symptoms, and try as much as we can to help him to recover from the stroke that he's having, and we'll update you on daily basis.
Thanks a lot, doctor.
Okay, thank you.
Time is up.
Okay.
Thank you. Well done, Dr. Sarah. Yeah, why you're stressed? Like first time you present communication.
Yes, because the exam is approaching.
No worries. You said I told you twice. I am counting for you.
Yes.
Okay.
Okay.
Yeah. This.
Okay.
Yeah. I hope you can.
That- Yes, you are right. I should.
Yeah. Try your best to stop it.
Yes.
Apart from this, you did great. Yes. No error here. You can convince. You can. As it's not mentioned as a negligence from in the scenario, so you cannot apologize or no need to apologize here. Just be sorry, feel sorry for him, for his father, for his suffering, for the stroke, for what happened. And yes, as you did, we can raise a report to the supervisor to check what happened exactly with him, and we'll update you with that. It's your right to complain. I agree with you. However, it will not affect his care and the problem of admission to the medical ward. It happens, and as you said, it's he can receive he was receiving or he can receive the same care by the stroke team, uh,
Yes.
whatever he is in, either the medical or social unit. And for the discharge, yes, you can update me in the next meeting if he's able to be, and you offer for the package care. It's a good idea. Yeah, yeah, I agree for it.
Yes, but I think I won't tell him the complaint won't affect his management because I'm encouraging him to do the complaint. So I will say if you want to complain, I can guide you for that and stop.
Yeah.
I won't say
Okay.
yes.
We always say it as
But
you
in the
know.
medical area itself, we can
Yeah.
reassure him that it won't affect. But I think this is not a medical area, so I won't go deeper.
Yes, I agree. Yes. Okay.
Yes, and
Again,
yes,
yes. Go ahead.
and the issues also is if any patient admitted in not the same ward, he will be as outlier or under the stroke team. They call it outlier. It means that he's not admitted in the ward, but he's under them. So they are the treating team. So I
Yes.
will
Exactly.
say
Yes.
to him that the treating team is the stroke unit,
Yes.
but he's admitted in other ward because shortage of bed.
Hmm.
So we will try to emphasize this in any scenario that he's
Yes.
under.
Exactly. Yeah. In general, well done, Dr. Sarah.
Okay.
But I want to clarify. Yeah, alaikum salam, Dr. Azhar. Go ahead.
Dr. Sarah, very well done. But I was thinking that this is she is a new Dr. Sarah because I do not know if the exam is approaching. Inshallah, inshallah, she will
Yes.
get through. But I do not know today. She was looks to me very nervous. Dr.
Yes.
Sarah, just remain calm. Just if you will have confidence, inshallah, you will get through.
Yes.
Your
I need.
approach is very good, and you are doing these communication scenario very nice. And today you were a little bit reluctant and you were a little bit nervous. Don't be panic.
Yes.
Inshallah, Uh,
Yes. I
inshallah,
need.
inshallah, inshallah, you will do it.
Hopefully.
Don't worry, don't worry. If you will be nervous, I think your mind will be stuck and you cannot do anything.
You are
But
right. Yes.
keep in your mind what will happen, what will happen. Lastly, but I will fail, but nothing will happen. Then, inshallah, you will perform very well. Don't
Hopefully.
worry, don't worry.
I think it's important thing in the passes is the self confidence, which
Yeah.
I
Yes, yes, yes.
and I should work on my self confidence. Yes, you are right. Thank you,
No,
doctor.
no, before you were doing scenario very, very nicely.
Yes.
Inshallah, inshallah, you will do very nicely. When
Okay.
you are
Yeah.
having the exam,
Next week.
Inshallah,
Thank,
don't worry.
inshallah. Hopefully, yes, you will do
Where,
it, Dr. Sarah.
where
And
your
thank you.
exam?
Yes. Well,
Where is your exam?
in
Which
Liverpool.
country?
Liverpool.
Inshallah,
Okay.
don't worry.
Yes.
Okay.
One
Always,
more
as
thing, Dr. Basu.
yeah,
Uh,
yeah. Go ahead, Dr. Azhar.
I was attending one more this session, and they were saying in that session the mentor was saying that it is a medical error. But although clearly
Yeah.
Dr. Hasham told that it's not a medical error,
Yes.
and it
Unless,
was also this.
unless, yeah, you continue the sentence. Unless they showed you in the in the paragraph or in the scenario, there is an error. They will write it clearly. There is some negligence, delay in the positioning. Okay, but apart from that, it will be clear that there is no error because they did the maximum care. They tried the best, and still it might happen. I agree for uncertainty. A lot of scenarios and cases carry the issue of uncertainty. So please don't be sure unless it's written for you. It's a clear medical error. If they mention bit sore here is a medical error, go with the medical error steps. Apart from that, no need to apologize. No need to follow the steps of medical error.
Yes,
Agree,
right.
Dr. Azhar? Agree? Yeah.
Uh,
Okay.
1 minute. One thing
Yeah.
I also want to ask you. It was also discussed in the session that when you are talking with the son or some other relative, don't ask the personal history like smoking, alcohol, because this is confidential. Is it true?
No,
No, it's
no, no.
yeah, it's something you have to ask about. Okay.
I think there's no harm if we ask about your father is smoker
If you
or
don't have
smoking
time, okay,
alcohol.
but if you have time, the maximum support you have to offer the family, the if he has problem with the financial, occupational therapist, rehabilitation. Here also good idea about rehabilitation, Dr. Sarah. We can offer a rehabilitation program, but you offer the package of the tier of care. So including the physiotherapy, they can do for him rehabilitation to be recovered as soon as possible. So I think it's a good idea to mention them. Do
Dr.
this,
Basu,
do this, yes.
what is rehabilitation? I also asked from
Yeah,
Dr.
it's
Hisham.
it's
Did
it's
not
the
understand.
same. It's program for the stroke patient to have a recovery fast by doing physiotherapy and the
Oh,
salt if they need some speech and language therapy management. Yeah. So it's like rehabilitation for the patient to be back to his normal as before. Okay.
Yes, I think I will tell him that he will be followed till he will recover, and with the occupational health therapist
Yes. Yeah,
will
exactly.
home
Especially
safe
the
for him.
occupational therapist. Yes.
Yes, he'll make his home safe for him for daily activity, and the physiotherapist will continue with him on discharge. I think this will be.
Yeah. They can go home as well.
Yes, they are going home, make the home safe.
Yes.
If he's living in the a house of two levels, they can allocate him to one level or put everything in one level for him. So they are doing the home safe, put the trail in the toilet, or give him a commode. They are making the him and life easy for him according to
Yeah.
the disability that he's having.
Yeah, they are trying to make him adapted well with his daily activity. Yes.
Yes.
Okay. Because of the debate about
Occupational
this point,
or what?
occupational therapist,
Occupational
yes.
therapist. And which
Yes.
team you mentioned, Dr. Sarah, about ulcer care,
Yes, it's called tissue viability team.
tissue viability team. We can
Yeah.
set like specified team if we can't regain this name.
No, the tissue viability team are the team responsible for bed sores, for any ulcers. There are some of the nurses that are doing the dressing, seeing the patient, and they have some scores for the ulcers. So it's any hospital has a tissue viability team. So I think the bed sores is seen by the tissue viability team. We can say it's a specialized team in the soreness that you have, but it's
Mm-hmm.
tissue viability team.
Yes. Mm. And I like the way that you said that this is a chance even not becoming zero even with maximal care. It is very good
Yeah.
expression, yeah.
Yes,
Yes.
the chance is never, the risk is never zero. I think we
Risk
can
is
use
never
this,
zero, yeah.
if we can use this for
For
infection
any,
control,
exactly. Not only for any infection, acquired infection, hospital
Yeah,
acquired
yeah.
issue.
Yes, we can say we are trying, the infection control team is trying to minimize the risk of having, but the risk is never zero. Sadly, the risk is never zero. So we can use it like this.
Very nice, very nice.
And yes,
Yes,
and we
exactly.
can complete this. The good thing is that we discovered this early and we keep caring of
Yes,
it
yes,
right now. Yes.
yes, we can say that. Yes, we are. We can say yes, the nurse has spotted early, so we started to manage him early. So hopefully he will be recovered.
Yes.
Yes, I like to focus and stress on the action, the medical and non-medical action. Always stress on this after discovering something the family doesn't like this scenario, that's all. So the action, yeah, we take care, we refer, we did the best, we doing our daily dressing and so on. And
Yes, I
for the
think.
non-medical, yes, I know.
Yeah.
I'm just trying to inform others. Yeah. When the non-medical or the non-medical will be, as you said, we inform the nursing care or the nursing supervisor or the head nurse to take care of this point and to improve the quality for our service to your father or any patient. It's a matter of showing, okay?
Yes. Yes, I think we will calm any patient angry. We'll say we'll spot it. When we say we spot it and we give him the maximum treatment, you will calm the patient with such words.
Yes, exactly.
Spot it
Agree.
immediately, so we interact and we give
Yes,
the maximum care. In any medical error, we can say we spotted, even allergy, we spotted quickly, and the team started to manage him. Because I think it's important in medical error for the patient not talking about the incident and all these things. The important, and if he want to complain, yes, but the important things the patient want to be reassured in the medical error, how you will manage and what will the person will have harm and how to minimize the harm that happened. So we want, this is the main things I think we need to spend time to explain how we will we correct this error for the patient and how to minimize the risk of having such error or having such medication. Not talking
yes,
about incidents. We can talk about the incident. We can say only we investigating this seriously
yes,
because we improving our care. We don't want this from happening again. And also for our learning, this is important also for our learning in order to prevent this from happening with other patient. But the main thing that we need to focus now is your father condition. So we will manage this error by doing that. So I think we'll make the patient calm by this. Yes, we will investigate it, but the important things we need to know how we will go on from this way, or how we will now with important things to focus on your father health condition and how we will manage this. So we'll talk with him about what we did as management or correcting this error.
yes, exactly. Okay. The comments, yes. I know there is always the debate about this point. Is it error or not? Again, if not written as clear medical error, please don't make it as an error. If
Take it as
it's
uncertain, yes.
Yeah, if written a clear error, go ahead with the steps and it will be clear. No worry about that. They will mention to you medical error in the task again and again and again. Okay. But if uncertain, we didn't mention error, so do the same as uncertain. I don't know what happened exactly. But don't say I don't know what happened. You can do it like you don't know exactly what happened, but you don't mention it. But we are trying to know what happened exactly, and we raise it to the supervisor. We did an action. We called the nursing for that, the specialized nurse, tissue viability, and so on. But don't say I apologize or
No,
don't apologize.
we can say only I'm sorry for what happening.
I'm sorry. Yes,
I'm
exactly.
sorry for how are you feeling now, but I want to reassure you we'll do our best. Let me have a discussion. Let me double check with the team what happened exactly, and then I will come back to you. But now we are managing his condition, so we'll make it like this, but make it as uncertain. It's not. Don't follow that incident report will be done and all
Yes,
things. If it's not written medical error, if it's clear medical error, okay, we'll make an incident and
exactly.
But if it's not, we'll say, I'm sorry about what happening. I'm sorry, how are you feeling now? I'm sorry about what has your father suffered. But let me explain for you the condition, and let me go back to the team or double check with the team, and then I will come back to you with all the information needed. So we can make it.
Yes, yeah, I agree. Yes. Okay, for the alcohol and smoking, Dr. Fazlur Rahman, I agree if you don't have time, it's not necessary to ask. But if you have time and you finish all your tasks, you give support, you provide the team, the follow-up, everything, if you have time, you can address it like if he is, we will have a talk with your father because such things might worse his stroke. It might put him under risk of another stroke in the future. No doubt about that. You can talk about it safely. Okay?
I think yes, it's better maybe because his son, he doesn't know how much he's smoking, and we will tell him that we will refer him to the smoking. So his son, he doesn't have the decision to take on behalf of his father. Maybe his father refusing to quit smoking. So we can say, I think he is right in this point. We can say we need to have a further discussion about if you have time, about your father lifestyle, and if some of this lifestyle affecting him. So we discussed with him, try to help him to have a healthy lifestyle. We can make it like this. No need to talk about smoking and alcohol with the son. I think it's also making sense.
Okay, but at least you can offer it to be in another meeting with the father, okay?
Yes. Okay.
Okay. Any other question or comment by others?
Dr. Basam, just I want to say we should make our routine at the closure 1C and triple S. C, do you have any concern? Then triple S. 1S means any sport at home. Then second S, source of information like leaflets, brochure. Then the last S1 is safety netting. We should make this habit so that we can conclude with the safety netting. 1C and triple S, it will have a good impact on the examiner. I think so.
Yeah, yeah, of course. But mainly it will be for counseling about disease, sextilating and the support you mentioned and the leaflet brochure. Here also you can offer, yeah, I will show you some leaflet brochure about it shows how you can manage. It's something which is an optional, not necessary. The necessary here to correct the action, to do the convince, and if he asks to complain, give him the opportunity to complain, and I will guide you if he insists, I will. Okay, but don't suggest it for him. Okay.
Okay.
Any question else? Thank you, Dr. Adnan and Dr. Sarah. We can move to the next scenario. No
Yeah.
questions.
Okay.
Anyone has question, please? Okay, so Mrs. Yvonne, 2 years old, diagnosed with pulmonary. She doesn't have extramarital relationship. Explain the plan of management. Okay, you can start in a second. Hello,
Hello.
I am Dr. Mukhtar. I am one of the doctor here. You must be Mrs.
Yes, doctor. I'm Yvonne.
Yvonne Hall.
Yes.
You are 40 years old.
Yes.
Yeah, I'm here to discuss about your health issue, and I want to reassure you this meeting will be confidential between me and you.
Yes, doctor. I'm coming to know the result of test they did for me, some blood tests, and also took some sample from my phlegm. So they told me that today I need to discuss it with you. That's why I'm coming to you to discuss the result of what's happening with me and to know exactly what I'm having.
Yeah, I'm here to address all your concern, and please, Mrs. Yvonne, whenever you feel any doubt, you can stop me and ask me.
Okay.
Uh, yeah, so what's your expectation about this result?
I don't know I'm having infection or what. So I'm coming to know which type of infection that I'm having because I'm having some cough and I lost a lot of weight the last few months. So I think I started to become weak and I think maybe I have a long-standing infection. So I'm thinking about that.
Yeah, I appreciate sharing this with me. And again, I want to assure you that this meeting will be top confidential. This is Yvonne. And let me talk about the result. The result of the scans and the blood tests are with me now. And I'm so sorry to say the result came as we don't hope.
So what do you mean, doctor? I have cancer or what? I will die?
I appreciate your worry, Mrs. Evan. It's not a cancer. Uh, the result showing an infection, which is very serious infection, and it's not only one infection. It's two bugs infection, and they are super bugs, both of them. It's called
Wait,
TB, and
what
yeah,
you are meaning? You're saying a lot of things. I couldn't get it. What you mean by heavy and bug and super? I don't know. Can you
yes,
tell me what exactly I'm having?
yeah. I appreciate your worry, and if you let me allow, if you allow me to explain for you. As the result showing you have what is called HIV and tuberculosis. Have you ever heard about any of them?
You mean HIV? It's AIDS, right? You mean I'm having AIDS?
I appreciate your knowledge. However, AIDS is at the advanced stage of HIV. We can name this AIDS whenever the HIV being advanced in the stage and you have a lot of infection along
Yes,
with the HIV.
I know, but it's called AIDS, and I know that it's not curable. And how I will tell my husband, and how I will tell my kids that I'm having AIDS is a very thing that frightening. I know there is a stigma for AIDS. Anyone knows that someone has AIDS, they try to be away from him, avoid him, treat him bad. How are you saying that I'm having this infection? It's-
Yes, we double check the result, and I appreciate your worry about your family and your care about your family. However, let me reassure you that the HIV now is one of the curable disease. If you have started the medication earlier, it might kill this virus, and you might live near normal life soonly.
So it can be cured from my body. You saying that?
Yeah, I appreciate your concern. Yes, it's one of the curable infection nowadays. If it's discovered earlier and you take the medication in good and regular way. Are you following me?
Yes, and okay, that's good news. And what you are saying, and what, and I know that AIDS can be transmitted sexually, and how my husband might have it, my kids might have it.
I
I don't know
appreciate
what's happening exactly now. You told me the condition, so my husband might have this condition or what?
I appreciate your worry and your care about your family again. However, we have to screen your family firstly to know about this virus in their bodies. So we can, don't worry about that. We have our perfect expert team. We can call your family by anonymous way and you can screen them without informing about your result. Hopefully, if you have a chance to tell them about this, it will be good just to do the best for them as well as for you.
But if I will
Oh,
tell my husband, he will know that I'm having an affair with other person. He won't accept it. So how I will tell my husband that I have AIDS, HIV, because this HIV is transmitted sexually. So I'm cheating him. I'm having affair with other person. So how you tell him? How I can tell him this?
yes, your concern is valid, Mrs. Yvonne. However, it's not necessary to be the infection started from you. It might be acquired from your husband. So we have no worry about that. We will screen the whole family and we'll know who's having the virus other than you. And no worry about these things. It will be done under confidential way without mentioning and your name until we reach to the result. We can update you, and we will have a meeting with your family members to encourage them if they have the results positive. How that sound for you?
Okay, but if you said that you will tell my husband, how you will tell him? He will know that it's me, the source, or who will be him, the source. How you will be able to tell him that? Didn't get it.
Yeah, we will message him as anonymous person has infection related to him, and after that we can do screening for him. How
Okay,
that sound for you? Okay.
I
Uh,
need
uh,
need to think about all of this because this is a lot of information that you are telling me today.
yes,
And
it
yes,
must be difficult to hear all this news once. And the other thing about TB, tuberculosis, have you ever heard about it?
no. So what is this?
It's a bug infecting and attacking your lungs, making your lungs distracted day after day if you don't start the medication on time. However, it's one also of the response, good response to the medication, good response to the medication if started earlier. So we gonna start this medicine for the bug for the lung first. Then after that, we can start the medication for the HIV according to our guidelines of the hospital. How
And
that sound for you?
and my kids can have also TB. You said this is infection in my lungs, so I can transmit it to my kids and my
Same, yeah. At the same point, we will repeat screening for the family. However, don't worry, we will do this by our expert team. They will follow up with you and the family members. From now onward, Yvonne, I hope you can use your private tools without sharing with any family member until we screen for who's having the virus and who's not having it. Is that okay?
Minutes remaining, less
and
than 2 minutes.
and when do you know how I can get this infection? I have only my husband.
Yes, some of our patients of HIV, they might get it from any contact with the infected patient. It's not necessary to be sexual contact. It might be with the piercing or tattooing, uh, sometimes with the blood transfusion, and sometimes with certain procedure like dental procedure.
I
Any
didn't
of
do any of these things, doctor. I have only my husband, and I didn't do so. Where I can get this infection?
Yeah, so for that we can arrange a meeting with our team to sit with you, and after doing the screening for all family, we can know from where exactly you got this virus. How that sound for you?
Okay, okay.
Okay, so you have any concerns so far?
No, I don't have
Any
any.
plan? Can I ask you some questions? Do you plan for any pregnancy soon?
No, I'm not planning.
Are you pregnant by any chance?
No, but I'm working as a nurse, which will affect me.
Yes, hopefully we will try to measure the virus in your blood, and if we find it in high level, we can arrange with our occupational team. We can sit with you and deal with it accordingly.
So I
Is
don't.
that okay?
Yes, I don't want anyone in the hospital to know about my colleague, because we have the same system. They might know that I have HIV, so I don't want that, and I don't want the GP to know about my HIV.
Yeah, don't worry about that. We can do this in confidential way. This is your right. However, I can
Time,
ask you if you smoke.
time. Okay.
Okay. You have a lot of concerns.
Yes, because this is a difficult scenario. I made it. I
Okay.
saw, and I don't know what's happened with this. What the surrogate was saying,
Okay,
but
continue asking the question. Continue, no
No,
problem.
no, no. It's enough. I'm full of concerns. That's it.
yes. So I don't know how the surrogate will say. I don't know. It's written no extramarital status, so
Yeah.
she might catch it
And
with her
finally,
husband.
you give me the job as
Yes,
exposure
yes, and
and
also
risk of
I
exposure.
add a lot because I see that many questions in this scenario can happen. Okay,
Yes, yes, you're right. Good
so
thing
so
to raise all
basically,
this.
yes, let me
Yes.
tell you my comment.
Yeah,
You
sure,
didn't
go
tell
ahead.
at the beginning, and you make it at the beginning, it's confidential. That's very important things. You make it at the beginning confidential. You didn't invite anyone because HIV is confidential. But you told me it's curable. HIV is not curable. It will be controlled, and the viral will be undetectable. So when the viral load will be less than 20 or less than 50, it means that it's undetectable, meaning that untransmissible. So yes, she can live her normal life. When the viral load will be undetectable, she can have sex without any safe. She can have her baby. When the viral load is undetectable, she can have the baby. The baby might not have the condition. Okay, so this is the thing. But if she will stop the medication, the viral load will return back. So it's not curable. Okay, it's controllable. So you will say it's controllable, and now there is a effective. We have different treatment effective for it, that it will make the viral undetectable in your blood. So it means untransmissible, undetectable, untransmissible. So you can have your normal life. You won't be transmitted these virals to anyone, and your immunity will be good. So you can live your normal life. Okay. And I think in this scenario, you need to explain the HIV, that it is a virus that by time it destructs the defense mechanism, so you will be weak and get more infection, which will be more severe. So when you have common cold, it can cause severe symptoms. And I think for this patient, she has at this stage, when she's having TB and HIV, it means that her CD4 count is low. Okay, because she has both infection, and TB is with HIV, and also when it means that her virus is high. Okay, so
Opportunistic infection.
So it's opportunistic, yeah.
yes, but you won't say that. You say it's not. We don't know it's AIDS or not. We don't have any information. So we have only information that he's HIV positive. So it's not us that will do that. The HIV team will follow you, will do for you further tests. We can start for you the medication and all of the things. It's not our things, and we don't know. It's not written that the CD4 less than 200 or more than 200. So we don't know it started to be AIDS or no. So we don't know anything. But if she has this infection, the TB, it means that you will tell her that it means that your body is weak, that you have this infection. So we need to go further from there. So this is the general knowledge about this case. Okay, so you will tell her it's not curable. It will be controllable and undetectable. And you will mean by undetectable, you need to explain undetectable, untransmissible. So you will live your normal life, your immune system will be good. You will live your normal life, you won't transmit it to any person. This is the important three things to say in HIV. Okay? Because HIV is in the body, but when you start the medication, it will be undetectable. If the patient stops the medication, the viral load will start to be high again, and they might have they might have the infection again. So only will make it suppressed and undetectable now. So you'll explain for her that I ask you a question. It's big scenario, and I think what an important thing, because the scenario need to talk about a lot of things. But what will happen in the real exam, the patient will have concerns, so you will address the concern. So one of the concerns, she will say, from where I can get this infection. So we'll explain for her it can be transmitted in different way. It can be blood, it can be, as you said, sexually. It can be transmitted by surgery, by dental operation, by piercing, by needles, by all these things. Okay, so you will explain for her that there is different way of transmission. But you won't tell her. She's asking from who will. You don't. We are not saying from where is the source of infection. We don't need to say that, and we don't care about that. So we'll tell her what we'll do. We can screen for the family. You can inform your partner so he can have it. First, offer it. Okay, because you said the anonymous, you give me the solution before offering that I should tell my husband. So what in such scenario, if she's saying I won't tell my husband, he might think that I'm having an affair. So you will tell her what is important now, your health and your husband's health. And I think you think that your husband's health or your wife's health is important. HIV now is a treatable condition, so we can manage it. And if it's developed to AIDS, it's a fatal things. They might die from infection, from very small, very weak infection. And you don't want your kids to raise without their father, or you don't want your wife to raise without. You make it like this, okay? try to convince the patient to tell her partner, okay? And if she refused, so you will give her so we can help you with that. We can make it anonymous by sending a text message to your husband or your partner telling him that you have been exposed to infection with HIV, so you can do the test. We can try to make it like this, anonymous, without saying the name. We can text your father by partner notification that he should do the test because he has been in contact with someone having HIV. This is the text will be sent to him without saying any name. This is the partner notification. Or we can make you can say we have our different way to breaking this news to your partner and to explain it to him if you give us permission. Okay, so first try to convince her that she should tell the partner because he's at risk and he might have it and might develop to AIDS, which is fatal things. And if she said no, okay, we have partner notification, we can send it without saying the name as anonymous message that he is at risk and as anonymous without saying the name. And or we can, if she's thinking heavy to talk to her husband, we can help her to, if she gives us the permission, we can talk to her husband. Okay, so this is a different way of disclosing the HIV. The other thing, this other concern I told you about, I'm a nurse, so you will say you still need to do some tests to know exactly how much the virus in your blood. So let take it from there, and we will see what happened. We'll discuss it with you will discuss it with the occupational health in your trust, and it will be confidential also, so they can help you by putting you not having direct contact with blood, or she might be a nurse in the surgery, so they will see what is your risk of transmitted infection, and then they can reallocate you till your viral load will be suppressed. Okay, so we can tell her that she need to notify the occupational health. They will do that after checking her viral load, because they need to know if the viral load is undetectable, which is not in this case because she's having TB. And the viral will be undetectable in few months of treatment. So you will reassure her, if you will be adherent to medication every day, your viral load will be undetectable in 3 months or 4 months. In few months, don't say accurate which months, in few months, and we have different treatment option. Okay, and in meanwhile, you should encourage her to have safe sex with her partner. Okay, so she will have safe sex with her partner. And as you said, should avoid put her all things that her things that might contain blood to will be sterile and to be her own, only these things. And this is the things, and we will, if we'll start medically the treatment, we'll start the TB treatment and then we start the HIV treatment, but we need to check all the tests, all the CD4 count and everything, because the patient might develop iris, which is as a reaction from the treatment of HIV. When you give the antiretroviral medication, the immune system will recover, and we can flare the TB and flare a lot of infection. So it's need to be discussed. It's difficult and suffocated and need to be discussed. We don't need to say this. Okay, don't say we'll start this or start this. No, we'll refer you to the HIV team who are expert, so they will see which treatment they will start first according to your CD4 count, which is type of cells in immune system, and according to your viral load. They will decide which medications they will start first. Okay, because this is difficult for us. Only the HIV doctors can know that and take the decision about that. So you don't need to say that. The HIV team will follow you according to the lot of tests should be done, and they will give you the treatment. They will decide which treatment they will start for you. This is, I think, my comment. And the kids also need to be screening for HIV. And I'm not quite sure this patient is open TB or no. If she has TB and open, I think she need to be admitted in the hospital and isolated till she will start the treatment with 2 weeks. But in the scenario, it will be written, and she will say, maybe she'll say, I'm having cough, so you know that it's open TB. So she need to be admitted and isolated. It will come in scenario, because the scenario is weird. I don't know. I saw it that came today in Kuwait or something like that. So according to the treatment, but if it's written that it's pulmonary TB, It's must that we say we'll admit you and isolate you.
Yes.
Okay, this is the
Yeah.
thing. Yes, so this is, and I think this other scenario might come, that the patient, her husband knows that, I don't know if the scenario came that the husband is HIV negative and she's HIV positive, so, and still she's still in the treatments, how she will manage with her husband. So we will tell her to have safe sex, and her husband will have pre-exposure prophylaxis and post-exposure prophylaxis in this case. He might have post-exposure prophylaxis if they had sex in the last 72 hours, and if they will, before having sex, they can take the PrEP, which is pre-exposure prophylaxis. But if she doesn't want to use the condom, but she should use the condom or have safe sex, and offer this. But I know this is difficult. You won't know it. It's difficult scenario to come, but it might. Maybe you will face it. So this is my information about the HIV and how we will deal. So we'll make.
No.
Yes.
I want to ask you about
Yes.
this TB is notifiable
One
disease. We will notify to the higher authority.
TB
I'm not,
only.
as the TB.
TB
I think the pulmonary TB only. I'm not quite sure the TB itself. I'm not quite sure about this, but HIV is notifiable.
HIV is also notifiable. TB is
No,
also notifiable. So we have to.
I'm not.
My second question is, as you said that we will send an anonymous text message. Then
Yes.
that we are thinking that you are at risk of having HIV.
No, the message is saying there is a system called partner notification. They will send a text message saying you have been in contact with HIV positive patient, so we should do a test for HIV. Like this. This is a text message will be sent. Or you have
You
been in contact with sexual transmitted infection. You have been in contact with one sexual transmitted infection. Sometimes also gonorrhea, we are notifying the patient, all the patients that has been contact with gonorrhea, chlamydia, so, or syphilis even at the beginning, if syphilis primary. So we'll send anonymous, if the patient doesn't want, we can send anonymous text message by saying you have been in contact with person with chlamydia or person with sexual transmitted infection. Please go to be tested and treated. Because
if the if the patient said that I don't have any contact with any sick person, then what should be our response?
I think we'll not do anything. You already told him, and he should be aware and ask about this, and he should do the test. What
Oh,
we that we will, our duty only to notify him, not to explain for him or what. If he want, he can call. So usually the patient are asking, is he coming to us in sexual health? I get a message that I have been in contact with gonorrhea. So what I will do? Okay, so you will have the treatment, and we'll screen you for gonorrhea. Usually the patient are responding and coming to be treated because they are afraid on their health. But it's not our responsibility to think after that. I think we send the partner notification and finish.
okay, okay. Thank you. Very nice explanation.
Yes. Okay. And this is, I think, this scenario only because not anyone even in the UK knows about the HIV. It's only the people working with the HIV. So the only things they want us from this scenario to ensure confidentiality, and to know how to convince the patient to tell the partner as much as we can, and explain that it's the risk, as we are explaining for any patient, the complication and risk of not taking medication, or risk of or not be compliant with the medication. We'll try as much as we can. If they refuse, we'll tell him we'll do partner notification and finish. And the other things, we explain for him that it can be this HIV can be controlled, and we have different treatment. And if it could be the patient that he work as a nurse and afraid that his colleague know about it. So no, in the hospital we can make only the treating team can see your notes on the system, and sometimes they are putting password on the patient that the treating team only can see the note, the treating team. And if the patient refuses to tell the GP about his HIV diagnosis, we respect that. Usually we are telling him better to tell the GP to be aware about the drug-drug interaction with the antiretroviral medication. But is he declining that his GP know about his HIV, we respect that. So when we are sending the discharge summary to the GP, we are not saying HIV at all. But The patient will take the normal medication from the GP, which is for high blood pressure, these things, and coming with us to take the HIV medication, and he's aware about the drug-drug interaction. So he will notify his HIV doctors that I thought this medication, it will interact or no of these things. So we are respecting them because HIV is very confidential. So we are not saying to the GP or anyone that only the treating team that involving in his condition. Or sometimes some people, HIV patients are admitted incidentally, and they're doing for them the routine HIV test, and they said it's HIV positive. So the HIV team will go to the patient, try to explain for him that everything confidential, only the treating team will be aware about this, and the patient is happy with that because it's very confidential for the HIV or any sexual transmitted infection to someone to know about any sexual history. They are very keen in this. This is for the HIV.
Thank you, Dr. Sarah. Good explanation and very good
Doctor,
details.
one
Yes,
question.
yes, go ahead.
Yeah, if the patient is refusing to tell her husband, and I think this a conflict interest you have as a medical team, you have to inform her husband about his condition. He may have HIV. He have right to know that he have
Yes,
HIV or not. And to be
yes,
tested, even if he refuse.
yes. So what we
By
are doing,
contact, yeah.
we are trying to convince the patient, and we'll try to do the partner notification. We'll try to make it, and if the partner is at risk at the end, but I think they should do a meeting and discuss it if they will be disclosed or not. But this is needs the
Yeah.
consultant and a lot of things to be done at the end to disclose it to the partner, but it will be done at the end. But we will try all the alternative way at the beginning, and I think it's not our level to go deeper in. So we will say,
Yes.
usually we will say that everything is confidential unless
Yeah.
there is a harm to yourself or to the others, or you give us the permission.
Yeah.
So this is
Yeah.
the meaning of going of confidentiality in anything. Usually we are
Yeah.
saying this to the patient, even in sexual health clinic at the beginning, we are saying everything is confidential unless you are at harm or you expose other people at harm or you give us the permission to disclose
Yeah.
it. So they are aware from the beginning of that. So in
Yeah.
such scenario, because I discuss it with a lot of HIV consultant, what if the patient refuse and all these things, we didn't get at the end. They couldn't even say we will disclose it. At the end, we can say we'll try our best to let the partner know by convincing the patient, by doing the partner notification, because it's difficult till now. Because also they said that sometimes you might not say, but you should tell because of the risk of the other.
Yeah.
So
Other
but
question, Dr.
you
Sarah?
isn't accepting to say to the partner or accept the partner notification. Usually it will become like this, one of these two options.
Yeah. This one other question. I think patient he have concerning about from where I get the HIV. He asked many times. Should I explore her background of her lifestyle or no need? Like
No, I
should
will
I
be,
ask her about extramarital, about her tattooing person needle? If
yes, as
she's what about her job? If she's yeah,
Dr.
if she
Bassem
get
said,
any
you won't make it as a question because in communication we couldn't take history. So you can say
yeah,
HIV is not only transmitted sexually, can transmit it by piercing, by intravenous injection, and drugs can be transmitted also by surgery, by dental procedure, by tattooing. So she will know from where she it's not us, we are not here, our role to know where is the source of HIV. What we are doing, our job is to know who has HIV and to treat him to prevent the transmission to others. But we are not spotting from where you got the HIV and these things. We are not thinking about this. So this is the main thing. So you can,
yeah. I think
yes,
not as a question as the person said you
yes,
have the
don't say
HIV have a lot of
yes,
have a lot
don't
of
you have,
weight on transmission. Do
yes,
you expose to anyone or not? If you will expose it, he will mention to you. Yeah. Okay.
yes. So you don't say, no, did you do that? Did you do that? It will be his
Yeah, yeah,
way
yeah,
in
yeah.
communication. So you will
Mm.
explain the general things, and he will think about it, and he can say, "Oh,
Yeah,
I did that too
yeah,
before." That so
yes,
be the cause. And when we
yes,
are trying to tell him to convince the partner, we can tell him, we can notify your partner by telling him there are several ways of transmission of HIV. So we can have a talk about him like this, and we have our way of disclosing this. So she might say, okay, tell him, and she might say, no, do the partner notification. And also, we are not keeping it only one time. We're making many meetings with the patient to try to tell him that he need to tell the partner. We give him time to think, and then propose for him the same. And when you saying that the HIV can be treated, so the patient we want to let his partner not having the chance to be treated, because it's fatal condition if it's not treated.
Okay, thank you,
okay,
Dr. Sarah. Thank you.
thank you very much.
Yeah, take care not to take any history. Just enumerate the causes,
Yeah,
and she can
just to
explore with
try to
you.
inform just about explore just only, not
Exactly,
take.
exactly.
Yeah,
Yes, exactly.
yeah,
Yeah, thank you for this
very
question.
important. Yeah,
Thank you, Dr.
thank you.
Ahmed. Okay, thank you, Dr. Sarah, for the scenarios and for explanation. Anyone has doubt or comment or concern, please.
About working as a nurse, any comment about this point?
So what I think, working as a nurse, I think she will tell the occupational health, so they will see if she's at risk with the patient. Sometimes some of the nurses are not dealing with the blood or anything, so they will reallocate her or no to other job, or and at
So
the
we will tell her that we will involve with the occupational
the
health
occupational health.
in her condition.
Yeah, the best way. I guess this is the best way. Refer her to
Mm.
the commissioner, and they will decide where she can be assigned, either office or.
No, they will check
Of course,
the
after
risk of
the
self.
viral load. Yes,
Check
yes,
your
Yes.
issue or your condition
Yes,
yes,
accordingly.
yes.
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 You check your condition, and you check the risk of having risk on you and risk on the patient of transmitting this infection. So they will assess the risk, and they might reallocate you. I'm not in a good position to answer this, but I will refer you to the occupational health, so they can address your concern properly. But I'm not quite sure what will be done, because I think when the viral load will be undetectable, they can work. I'm not quite sure, because it will be untransmissible. So they
Yeah,
can
but to be safe, better to refer. I
yes.
agree.
So the occupational health it's not us even for that. It's not the doctor or HIV. She will go to the occupational health in the hospital. Every hospital has the occupational health, not for the patient, for the doctors. To notify for the needle stick injury, to notify for about this infection, type of infection. So they are the team specialists in that, so they will address your concern. Only you'll tell him to the occupational health team are in better position to explain for you that, because they might see the risk, they have some guidelines. So I'm not quite sure what will happen next, and you won't lose mark of this, because you don't need to know about the occupational health, the job. It's not doctor
Yes.
job, this.
You're right.
Okay, thank you, Dr. Aisha. Any other question? Any comment? Yeah, TB is notifiable. Let's read the comment. Thank you, Dr. Tanya. HIV is not. The patient need admission, of course, if he has TB symptoms like coughing blood or lopsis or loss of weight or night sweat. It will be clear in the scenario. Okay, thank you, everyone. If no more question, we can end the session. Thank you again, Dr. Sarah, for the practice with me.
Thank you.
Inshallah, tomorrow we'll see you with another clinical day. Good luck and good night. Assalamu alaikum wa rahmatullahi wa barakatuh.
No,